Hannah. I care for my younger sister who has autism. When she's struggling, I'm usually sort of kept in the dark and I won't really get told what's going on because I'm too young or like I won't understand, when actual fact I've had years of that experience, so I do know what's going on and I can help. Last year things got quite bad and I went to see a counsellor, but it didn't work. She made me feel like bad about my caring role. She said stuff like, does it help your mum if you're worrying about your sister while you're at school? And that really sort of threw me off because I know it doesn't help my mum, but like being a young carer sort of comes in its own package. Like you're gonna worry, you're gonna feel all those things, and that's normal, but no one sort of understands that, and that's why I just want more people to understand.
Hi, I'm Holly and I look after my older brother who has autism. I'm talking about a story today of a young carer who reached out to a company that specialises in young people's mental well-being. This young person, they reached out because they were really struggling with their mental health but received no support. They were turned away and weren't taken seriously. They were turned away despite having talked about how they were considering self-harm and spoke about all the problems with their mental health that they were experiencing. I think it's really important that young people and young carers, their mental health is taken seriously, because obviously young people live a very stressful life as it is, and for young carers it's about 10 times more stressful. And then when their mental health isn't being taken care of or neglected, then it can have a massive impact on home life, on their schoolwork, and on those other aspects of their life.
I'm Quinn and I care for my mum and my brother. It was just a normal day and we were off in Asda, just buying just normal stuff, and she sometimes has seizures, so she fell down, started having a seizure, and so obviously due to their Asda's protocol, they phoned 999. There was an ambulance coming, but the paramedics just kind of ignored me. They just kind of blanked me because I was a child. They just completely just ignored me, even though I had all the answers to what they were asking. Like they didn't know what was going on, and obviously I did, because we have to know a lot about who we care for, because we spend all the time with them.
Hi, I'm Lily and I care for my dad, and he's an alcoholic and I've looked after him for many years. My story is about when I was a bit younger, I'd say about 13. I went to a school and I didn't really have much help, but I found a teacher that helped me with obviously my anxiety and obviously looking after my dad and things, and it really made me feel better. She later made a group for young carers, all the young carers to go in, and I started to feel like I belonged somewhere, because before I didn't really feel like I belonged anywhere. Apart from this teacher, I didn't have any help at all within 3 years of being at that school, and it was a pretty bad chapter of my life.
I'm Sam and I care for my dad who has severe physical disabilities and mental health disorders, and I just live with him. When I was 12, my dad was bedridden. He couldn't move or talk and only groaned because of the pain that he was in. I called for the GP 6 times, but no one came out. They just kept telling me to wait it out to see if he gets better. Because of the fear of my dad dying, and I was terrified because of my age and living only with my dad, I called for my grandma. My grandma called for the GP and they eventually came out, but it was highly reluctantly. When they came, they took my dad away because he needed to go to hospital. He was in there for a week, but I was offered no support with my mental health or asked if I was okay by anyone other than my family, which had a very significant effect on my mental health.
Hello, my name is Hugh, I'm 13 years old. I'm a young carer for my mum, and an experience I've had with a social worker was a couple of years back now, and it wasn't the best experience ever. They'd come and visit me probably for about 5 minutes and say they've done their job, which really they haven't. She really didn't help with anything I was going through. She stayed there for about a good 5 minutes and it wasn't effective to me at all. She could have stayed more and probably actually listened to me. She could have said something which would have made me feel better, but she didn't, so.
My name is Ro and I'm a young carer for my mom. My mom started feeling very unwell when I was little. Since my father wasn't around, my mom got depression. Once my mom was not okay. She really needed help and I tried everything. I tried to call the doctor, but they wouldn't listen to me because of how young I was and because my mom couldn't speak proper English, so she couldn't talk to them at all. And they wouldn't believe me, so they didn't do anything and we just had to take care of her ourselves. And I just wish they would have helped and supported more.
I'm Ali Keys, I'm head of Year 9 at Oasis Academy Brightstow and also a maths teacher, so a busy man on the ground at a secondary school. I think within education there's a lot that can be done. I think communication between all professionals, whether that's members of staff or social workers or medical professionals that are perhaps part of a bigger team for that child. I think I've learned today, having listened to a lot of the young carers around the table, that they have a lot of people in their lives and a lot of professionals, and I think sometimes us as professionals can think the way that we might like to direct something is the right way because of past experiences, but without actually having the input and the voice of the young carer. I also think that young people and young carers in particular from today are crying out for consistency. So if we've got a young carers group, if that is on a Wednesday lunchtime, that is on a Wednesday lunchtime. It doesn't change from one week to the next because actually you need that consistency to plan your time. I'm also going to take away, and it's other things that we can perhaps develop, is really kind of understanding that if a young carer hasn't done their homework or something that is deemed to be really important by that member of staff, that there are reasons for that, how staff can perhaps support you guys in ensuring that you get it done, because you're not young people who want an excuse, you're young people who want support, care and love to ensure that you can do your very, very best.
So my name is Ali Fry and I'm a school health nurse. I think after having a conversation with some other young carers, it was interesting to know some of the difficulties that they have accessing our service. So it's made me think about what we can do specifically in our service to support you better. We do ask on some of our assessment sheets about if you're a young carer, but I guess we need to be a bit more mindful about finding out exactly what that means to you, how it affects you. Hopefully we can give a lot of young carers some ideas about how they can support themselves at an earlier stage, which would be quite good for most people actually. If we can get things quite early on before they escalate and become a huge difficulty for people, then that would be the ultimate thing.
My name's Simon. I'm a key worker with the Young Carers Service. Working together is something that we all strive to do as professionals, but there's so many points that it can fail. I think in the discussion we had earlier, trying to recognise those points is something that every single professional working with these young people can do, and because you can put all the support in the world in place, but if that young person doesn't know it's there or it's going on, that's gonna not be helpful to them, because sometimes you just need that reassurance, that understanding for the young person that, yeah, this is in place, I can feel okay, I can feel kind of supported, because that's so important and valuable.
My name's Tracy Baker and I'm a school health nurse. Going from the discussions that we've had today about looking at kind of what we can do of actively going out and finding out more in schools, what the problems are and how we can support young carers a lot more, and that might be linking up with the school young carers link worker and maybe offering more accessibility for young carers to be able to access us more readily. And it's given us some thoughts kind of today of how we can best do that within kind of our structure and our service.
My name is Rachel Brown and I am a safeguarding social worker. So I work with children and families on any matters that could be affecting the child's experience. So I think there's still a lot to be done for young carers. I think we've come a long way, but I think that there's still a journey to be taken in getting everyone who's involved with young people's lives to have that mindset of, is this a young carer? But I think we don't yet have that culture where everyone is doing that and everyone is trying to identify young carers and also empathise with what it's like for them on a day-to-day basis. And I think social workers can play a really important role in identifying young carers, making sure they get lots of support, but also improving the culture so that schools, hospitals, all agencies around a family are much more able to identify young carers.
According to a survey completed by the Carers Service in September 2019, 92% of young carers said that they felt stressed.
Nationally, 68% of all young carers are bullied because of their caring role.
45% of the young carers are not happy in school.
1.5 million people care for someone with ill mental health.
76% of young carers report being low or depressed.
According to a recent survey by the Young Carers Service, 37% of young carers report that their caring responsibilities will force them to think differently about their future.
78% of young carers report struggling to sleep.
40% of young carers believe that they cannot carry on.